What I wanted to tell you aloud is the history of rivaroxaban, and that means in general the history of an invention of a new drug. A lot of scientists are interested to find new drugs, and so why is it? Because we have a vision as a scientist. I want to find something new in the management of disease, and that is always the first thing, to have this vision. And then you must know where to go, what indication you want to address to, and therefore you have to know where is high medical need for improvement. That is then the next step. Then you have to think more in preclinical research, and that is the part I will focusing on. You have to understand the disease, why the disease develops, and especially on the molecular level. Then we can find a new target to attack then this disease. That is the path forward, and after identification of the target, you start the research for a new molecule. And after the end, in case you are happy enough to have find a new molecule to treat, then you have to identify it to see if it is safe and if it works as it has to work. And that is all done in preclinical research, and that you have to do in a team of chemists, biologists, biochemists, and a lot of other people who are involved in this pathway of the development of a new innovative drug. The next step, you have to translate this preclinical research into medicine. And you have to see if this medicine or the drug you have developed works in man, and especially if it is safe. And that is really a task to show that the drug is safe. And then if you succeeded to show that it is active, the drug, then comes the next step. And that is to come on the market, to get the approval by the authorities. But I wanted to concentrate here first on our vision, and then the preclinical research to understand the disease and at the molecular level, and then later on how to find a molecule. Why do we get venous thromboembolism? So first of all, here's the blood man. You see the venous and the arterial system which transport the oxygen from the lung and then delivers the oxygen, our energy, to the muscles where the oxygen is needed, and then our hemoglobin is freed from oxygen and transports then coal dioxide, and that has to be gone to the lung here. And thus we have a very complicated vessel system. You all know that what happens when you have an accident with a knife or a needle, then you bleed. Then what would be happened if in case the bleed wouldn't stop? You would bleed to death. So nature has invented our coagulation system. That is one part of the side of the protection against bleeding to death, but I will concentrate today on the coagulation system. Very important is also when does it bleed after a traffic accident, for example, but also after or during a surgery. And what very often happens after having a knee surgery or a hip replacement surgery, you have a very high incidence of venous thromboembolism. If you are not protected against the development of this thrombosis, then about 45% of people would get a thromboembolic disorder. Now we come to the molecular level. We have identified a disease with a high medical need, and now we want to see how can we find a new target to develop a drug to fight against this disease. Nature has developed our coagulation system, and this coagulation system is very highly regulated. So you have not only one way to protect against bleeding to death, there are two pathways, and both pathways are combined by a potent factor 10A, that is a molecule, a protein, an enzyme. And this enzyme then, this factor 10A, activates prothrombin. So normally we have in our blood inactivated proteins of our coagulation system, which I mentioned here. But what has to be done, that is in case you have a vessel wall damage, all these factors has to be activated and at the end leads to fibrin and then close the vessel and it doesn't bleed anymore. What has this molecule to do? It has to stop within the coagulation system. It has to stop that there is the development of a clot. But on the other hand, as you know, if you completely stop the clot or the thrombus development, then you can bleed. So you need a balance between bleeding and clot formation. And that makes the things very difficult. Our chemists succeeded here to synthesize this compound, and this is rivaroxaban, it is called. This molecule then we thought is an optimal compound to give it further to our people in clinical research after when we were aware that this compound is also safe. This is an X-ray structure of factor 10A. And here that is rivaroxaban. And you can see this L-shaped structure. And here you can see it again, how nicely fit it in the grooves of the factor 10A molecules. And so it is very important that a molecule which inhibits factor 10A really fits in this groove. You can imagine that if you have a plain molecule which is only like this, it wouldn't fit there, it wouldn't work. So you need this L-shaped structure. And that is also very important when you want to block the activity of an enzyme. You have a specific drug or a specific molecule which fits in the so-called catalytic site where the compound or the enzyme is active. In case of rivaroxaban, and that is not only for rivaroxaban, that is for a lot of drugs nowadays. You need a long time for development. We started 1998 and we came on the market 2008. So you can see 10 years for development. And so I showed you a small group of chemists, pharmacologists, biochemists, but that means to come on the market, you need a huge group of people, not only scientists, also economics and so on and so on. So you can see nowadays, to come to development a drug, that at the end you need a huge team.